Lancashire Care provides a wide range of health and wellbeing services across the county, and an important part of that are our services for people with mental health problems. The vast majority of those people can be very well supported in their own homes, but when people are very unwell, then they need good quality inpatient facilities. We do have facilities across the county right now, but they're not of the quality and standard that we think people deserve. So we're committed to building some new ones, and the Harbour is the first one of those, and we're delighted it's going to be a state-of-the-art facility for people who need it when they're really very unwell.
This is the first of 4 facilities for Lancashire Care that will be produced over the next several years. The intention is to make sure that this one, finished and occupied by 2015, is the exemplar, and it will create the precedent and the learning that will enable our later facilities to pick up on that best benefit.
Gilling are experienced healthcare architects. We work in the acute and mental health sectors. The Harbour is probably one of the biggest mental health projects we've been involved in the last few years. All our successful projects have one common theme, and that is meaningful and long-term service user engagement. The Harbour's been no exception to that. We've done a lot of work with the service users. A lot of it involves listening, a lot of it involves responding to what we hear at the meetings. Open dialogue, an ongoing process that we don't want to dip in and out of, hence the service users are part of the design team.
We've had a lot of influence.
Well, we was listened to, which I was surprised that they listened so well.
They've involved us. They've made suggestions that we could either agree, disagree, or come up with a different idea.
Well, we wanted single rooms with their own showers and televisions. They were all on ground level, which we wanted them to have. Yeah, I'm quite happy with the way it's all worked out, and I can't wait to see it built.
Today's a really significant day because it's topping out. So it represents the completion of the last of the blocks on the building, and now we're into finishing the internal areas in preparation for getting the commissioning and the patients to move in. This is a significant development for the Trust. It's 154 beds, and it represents the first of our new inpatient facilities for Lancashire. The contractors have battled through the winter. They're still on track, and we're now 2/3 of the way through the build programme. We're looking to bring patients and staff into the facility in February 2015.
We have now arrived at Functional Acute Ward 2, where we've created a special walk-up room for people to view as part of the topping out ceremony. We've plastered the walls and given them a mist coat of paint to give people an impression of the size of the finished article. As you can see, there's still bedroom furniture to go in, but we do have the window in place. The window is a special window in the sense that it's robust construction, anti-ligature, and allows the patient to have free access to open and close the window should they so wish. Should the patient be in an agitated state and continually try to open and close the window, we have the ability to lock it off. As part of the building process, the contractor decided to build his ensuite pods off-site and arrived as a one-off unit. This allows the contractor to proceed at pace without the need for further tradesmen coming in to the bedroom. So within the ensuite itself, we have specialist wash and basins and toilets with proximity centres for the wash and basin, toilet and the shower with a plastic window.
In terms of environmental and sustainability issues on a project of this size, we do have an existing wetland area here which we're very conscious of. We've had to protect that, but we also have works to enhance that by forming a new wetland area. In terms of labour for the project, wherever possible, we'll be sourcing labour from the local community. In addition to that, we're involved with a business called Blackpool Build-Up, which provides training for adult learners, and we can source labour from those guys as well.
The Harbour will improve patient care considerably to what we have now. It will enable a recovery approach to that care and enable people hopefully to get back out into the local communities a lot quicker than we're able to at the moment.
And the fact of having individual bedrooms will give much more privacy and dignity to patients' experience, which actually helps their recovery and helps us develop individual plans, because you can help them with making their beds or taking their self-medication. We're in their own bedrooms, where at the moment we're in dormitories and you can't do that. So it'll improve the experience greatly from that level.
The investment for the Harbour in particular is going to be worth every penny spent. The Harbour will be the best of the best.